there's a lot about what we do that you don't get taught in medical school or in residency, and particularly I think about the values of how to ally quality and cost outcomes in patient care. The sort of holistic view of the system is something that doesn't get taught, and I think we should do a better job of that. I think it's part of the reason why healthcare costs in our country are so out of control. And so advice I would give is really seek out opportunities to understand a little bit more about the breadth of the context of care delivery, and also to recognize the importance of, I think, a human touch. I think that's something else that's missing often, is that so much of our care is individualized and patient-centered, and you can do that, and you can be highly intensive in your touch in the CCA sort of model of care and still be cost-effective and provide high-quality care.
I agree with that. I think the other key is that you have to continue to see patients to develop and to run the programs effectively. You have to actually feel both the joy and pain of those programs. So I think it's really important, if you're going to be a physician administrative leader, that you're still very much embedded in the everyday clinical world that you're creating and ultimately responsible for, in both the good and bad parts of it.
Yeah, I think for CCA, the driver of what we do is the clinical needs, and how do you know what the clinical needs are if you're not actually engaging with that system? And so I think that's really true.
And I think in an emotional spiritual process, it's important to have some wins.
Yeah.
And patient care can often give you the wins that are slower to develop at the administrative programmatic process.